sleep problems can be a sign of the illnesses themselves. Having said that, not having enough sleep can sometimes also trigger these mental illnesses. So the relationship that way is pretty complex. So not having enough sleep can certainly exacerbate a lot of these conditions. And that's why it's very important to address sleep issues. For example, a patient with a known diagnosis of, having bipolar disorders, and if they start to go off their sleep, can sometimes trigger a manic episode. Or not having enough sleep can sometimes make many of our patients to go and self-medicate. As in, what I mean by self-medication is use drugs, alcohol, etc. for them to get enough sleep. Sleep problems can present in many different ways. Sometimes people can have poor quality of sleep, although they sleep well for the entire duration of the night. They may still wake up and feel that they have not slept very well at all and they don't feel refreshed. We see this very commonly in many depressive conditions. We also see other kinds of sleep problems like having difficulty falling asleep. That is what we call initial insomnia. Could be seen in depression, psychosis, mood problems. Also other physical health conditions, for example, like lung conditions, sleep apnea syndrome, where the quality of the sleep may not be good and they may also have difficulty falling asleep. The other thing we also come across is difficulty in staying asleep, that is broken sleep. It could be a combination of these different kind of sleeping conditions that we have in all these mental health issues. The other thing we can also come across is excessive sleepiness, what we call hypersomnia. That can also be seen in some of these mental health conditions. So what's actually important is to find out what is the nature of sleep, what's the quality of sleep, and what is the particular type of disturbance that this particular person is facing. Is this a repeated pattern when they are unwell? Is there a different pattern when they are well? These are the kind of things that become very important. And sometimes it's also important to see if they have related physical health conditions. First and foremost, as I said, it's very important to try and find out what is the nature of disturbance so we can try and fix it. So if this is stemming from a mental health issue, then we need to try and address that particular issue. It could be use of medication, it could be use of talking treatment, it could be a combination of the two, depending on what we see in the individual. There are some very basic fundamental approaches that we all could undertake in order to improve the quality of sleep. For example, there is this thing called sleep hygiene or sleep routine that we all perhaps need to undertake in this age and time. It could be simple things like trying to go to bed at a certain time every single night, bringing in that personal discipline so they can try and go to bed every night. So eventually the natural sleep kicks in. So it could be a series of activities. As an example, it may be that you finish dinner. After dinner, you may want to take your pills and then have a cup of milk, go for a hot bath. It could then be that you're going to read a book, with all your lights switched off and just with a bed lamp on. You may just want to do this every single night until the brain also starts to understand that you're winding down and that you need to go to bed. Some of the other things that we'll have to do would be cut out excessive alcohol if that's an issue. Cut out smoking, particularly late evenings, because it's a stimulant and it stimulates the brain. Staying off illicit drugs because they can also affect the sleep cycle. And ensuring that some of the other things like going to the toilet, etc. are taken care of so you don't have to try and get up repeatedly during the course of the night, which can also affect your sleep.